And to introduce Sarah Whittley. Sarah is a clinical trial manager with the Department of Surgery and Cancer at Imperial College London. Sarah currently manages the NIHR-funded multi-centre cluster randomised control trial examining the benefit of graduated compression stockings in the prevention of venous thromboembolism in low-risk surgical patients, also known as the PETS trial. And as many of you will know, this is following on from the GAPS and CHAPS trials. She's here to present and update us on this important work and also to share how other centres are being invited to get involved and would welcome your involvement. Please do share your comments and your questions using the chat or the Q&A tools on the screen with Sarah, and she will also leave her email address online while we discuss at the end, so that if you want to email her privately, you are most welcome to. So without further delay, let me pass over to Sarah. Thank you.
Thanks very much, Jo. So as Jo has just highlighted, I am Sarah Whitley, and I'm the trial manager for the PET study, which is examining the benefit of graduated compression stockings in the prevention of VTE in low-risk surgical patients. So as all of you will know, most patients will receive thromboembolic TED stockings if they have been admitted for any interventional procedure and on most medical wards. And TED stockings tend to not be that well fitting, and it takes up quite a lot of nursing time trying to get these fitted appropriately. So the PET study is a cluster design study looking at low-risk surgical patients to see if these surgical stockings are of any benefit. And just a bit of background to the PET study. Hospital-acquired thrombosis refers to any VTE-related event within 90 days of hospital admission, and it's an important clinical problem, and surgery is an established risk factor for VTE. PETS is the natural follow-on to the GAP study, which found that graduated compression stockings offer no additional benefits when combined with low molecular weight heparin compared to low molecular weight heparin alone in patients who are assessed as being at moderate or high risk for developing VTE and who underwent elective surgery. And there have also been 2 recent systematic reviews to date, which have found that there's a lack of evidence available on the use of compression stockings in low-risk short-stay surgical patients. And there are also discrepancies between what the NICE guidelines state and what happens in standard practice. Hence then the need for the PET study, which is evaluating the benefit of compression stockings in the prevention of VTE in patients undergoing short-stay surgical procedures and who are assessed as being at low risk for developing VTE. In terms of recruitment then to the PET study, we are hoping to recruit from at least 50 NHS trusts or health boards across the UK, and we'll be recruiting just under 22,000 patients who are undergoing short-stay surgical procedures and who have been assessed as being at low risk for developing VTE. And the PET study is a cluster design study, which means that randomisation will occur at site level as opposed to the individual participant level. So trusts will be randomised to either stockings or no stockings, and trusts can choose which individual surgical specialties they would like to involve in the study. And trusts will be informed of their treatment allocation once confirmation of capacity and capability has been issued by the local R&D team. And in terms of data collection and participant flow, due to the nature of this being a cluster trial, patients only need to consent to be contacted to be followed up at 7 and 90 days. And consent can be obtained verbally in written form, or it can be obtained electronically at any point prior to the 7-day follow-up. And the follow-ups at 7 and 90 days will be conducted centrally by the coordinating team at Imperial. And these again are collected remotely via telephone, online or SMS. So the only responsibilities then that lie with the local site staff will be identification, screening and consenting participants. And the primary outcome then is the rate of symptomatic VTE within 90 days. And then the secondary outcomes include mortality, quality of life, adverse events associated with wearing the compression stockings, and a cost effectiveness analysis will also be performed. In terms of the eligibility criteria, patients will be eligible if they are between the ages of 18 to 59, if they are scheduled to undergo a surgical procedure with a hospital stay of less than 48 hours, and if they are assessed as being at low risk for developing VTE using the Department of Health risk assessment tool. So if they score 0 within the thrombosis risk section of that tool. And patients will be excluded if they require IPC therapy beyond theatre recovery, and if they are female patients of childbearing age who have had a positive pregnancy test, then they would also be ineligible. And then this is just a flow chart of the study outlining that patients will be approached, consented and screened by the site. They will then either receive stockings or no stockings, depending on the site's treatment allocation. And then follow-ups will be conducted centrally at 7 and 90 days post-procedure. In terms of study timelines, the study officially started on the 1st of April, and the first patient was recruited on the 8th of September. And so far, 156 participants have been recruited to the study. And recruitment is open for 30 months, so it will close on the 31st of March 2025. In terms of what sites will receive, sites will be reimbursed £28.20 for each patient that is consented and is eligible to be contacted for follow-up. And for anybody who would be interested in your hospital or your trust participating in the PET study, please feel free to reach out by emailing either me directly or else by emailing the PETS trial inbox. So that was just a very brief run through of the PET study. Thanks everyone for listening, and I'd be very happy to answer any questions that anybody may have.
Thank you, Sarah. That was really interesting. And yeah, thank you for leaving that slide on so that people can see your contact details. I know PETS also have an exhibition booth in the exhibition hall where you can link and get both further information and contact details. So if you haven't taken this down or forget to, or talk to a colleague who would be interested, please go to the exhibition hall, because the really important thing, I'm sure, is that the trial wish to recruit.
Yeah, that's correct. We have a big recruitment target. It's 22,000 patients. So the more sites we can get on board, the better. And as Joe said, the PETS trial website, there's a link to that in the booth. If you just click on that, then you can get all of the study information and the team's contact details as well.
Obviously, looking at it from a practitioner's point, it's a really important trial, but would it be a lot of extra work for individuals in the hospitals, or are you able to support them in most of the perhaps IT or the patient information or anything like that, the setting up?
So the majority of the kind of procedures that are needed to enroll patients into PETS is actually conducted already as per standard of care. So the only sort of extra procedures that need to be completed would be an EQ5D questionnaire and then obviously informed consent. We've tried to make the study as flexible and as kind of least burdensome as possible. So we've allowed consent to be obtained electronically, and we're very flexible in terms of how sites kind of want to hold their documents and how they want to transcribe that into REDCap, what their source documentation is. So we want it to be the least amount of work for site staff as possible.
Thank you. And certainly for Thrombosis UK, this is a really important trial because it comes on the back of the GAPS trial and CHAPS, which I believe is ongoing. And the evidence from that has certainly influenced NICE and supported people implementing change, which saves money and also is better for patient experience and patient care. If people want to see the information about those previous trials or the ongoing trial, where can they go to read that, please? So
they can either email me directly and then I can provide you with all of the study documentation, depending on which study you want me to let you know about, or else they are both registered as well on the various clinical trial networks, so clinicaltrials.gov and ISRCTN as well. But just feel free to drop me an email on my email address that's at the bottom of this slide, and I can provide you with any other details regarding any of the other studies.
Thank you. And I know a summary of each is also available on Thrombosis UK website, but I think contacting you will give you the full information. Really a good question here. Is the trial, the PETS trial, open to the Highland sites, so the whole of the UK?
Yeah, it's open to the whole of the UK.
Brilliant. And obviously, if anybody watching now is interested, I think we'd also urge them to share it with colleagues at other local hospitals to get them on board.
Yeah.
Brilliant. Thank you very much, Sarah. We don't have any more questions, but I would like to reiterate that if anybody would like to know more or to make contact, even if they're just sort of thinking about it or want to go back to their trust and discuss it with their team, please do contact Sarah or visit the PET stand in the exhibition hall and make contact through that, because this trial could go ahead, or will go ahead, but what it can do is change our practice and improve it. So thank you very much. Thank you, Sarah, so much. A recording of this will be available shortly as well, so you can share with colleagues who also want to find out more. Thank you very much.
Thanks very much. Thanks everyone for listening as well. Thank you.
Thank you.